Can I first thank the JCWI for this timely report? I hope you've got it in front of you, and for its contribution to two distinct but important areas of concern. The first is its intervention to the ongoing debate around the terms of reference for the upcoming public inquiry into COVID. And this report is clear that whilst government may have ignored the plight of thousands of undocumented migrants throughout the pandemic, it must not be allowed to do so again in the public inquiry. If lessons are to be learned, then the discriminatory approach this government took to undocumented migrants must not be replicated in the public inquiry itself. And secondly, the report makes yet another argument, should ever one be needed, that whilst the policy of hostile environment is morally repugnant, it's also logically inconsistent with any effective public health strategy against a viral outbreak such as COVID. So this report highlights in very clear terms how many undocumented migrants have been on the front lines of the pandemic, with little option but to take work, no matter how poor the conditions. By failing to support undocumented migrants and leaving the hostile environment intact throughout the pandemic, government exacerbated an already critical situation, one that no doubt contributed to the UK having one of the worst per capita COVID death rates in the entire world to date. So throughout the pandemic, my own experience as both a constituency MP and a broader campaigner has shown how half a century of economic policies designed to generate inequality and economic apartheid acted as the perfect petri dish for this virus. After a decade of austerity, the very fabric of our social infrastructure and community resilience was left in tatters, just as it was most needed. This was perfectly summed up in two reports I chaired the launch of. In July 2021, the UN's Committee of Racial Discrimination explained clearly how UK migration policy had directly led to migrants avoiding COVID healthcare help because of migration enforcement concerns. Whilst in June 2021, a report on skilled migrants revealed how the government's hostile environment was encouraging rights violations of migrants and denying them access to basic services such as healthcare and housing. So to discuss this, the report and much more, we'll be hearing from the report's author, Caitlin Boswell, Francesca Humi, the Kanlungan of the Filipino Consortium and a contributor to the report, as well as Blessing, another report contributor. I'll hand over to Caitlin Boswell first, and just a very quick introduction to Caitlin. Caitlin is the Policy and Advocacy Advisor at JCWI, and over the past year, she's worked in a range of campaign areas, including the organization's campaign to support undocumented migrants and migrant workers in the UK. And previously, she worked as a support worker for migrant women facing immigration restrictions in the criminal justice system. So over to you, Caitlin.
Thanks very much, Clive. Right, I'm going to try and share my screen. So Mary, if you could let me know if this works. Let me just get it up. Sorry, bear with me. Okay, is that now you can see the screen? Yeah, great. So yeah, thanks very much everyone for being here. It's really great to be here with you all. I'm going to be talking today as a kind of very brief overview of the research and the report that we've been working on. The report is titled, "We Also Want to Be Safe, Undocumented Migrants Facing COVID in a Hostile Environment." So as many of us are aware, the COVID pandemic exposed and exacerbated existing inequalities, with clear evidence showing that Black and minority ethnic communities have faced higher rates of infection and hospitalization. Migrants within this cohort, particularly those with insecure immigration status, exist on the sharpest end of the COVID crisis, yet their stories are often overlooked. This report aims to bring to life some of the experiences of undocumented migrants. We focus on financial insecurity, work, housing, and access to healthcare. And the report highlights how in all these areas, the government's hostile environment policies have heightened the effects of the COVID crisis. This report is a qualitative piece of research based on 13 interviews conducted in London at the end of last year. 10 with people with experiences of being undocumented during the pandemic, and 3 with people who work with and support them from Kanlungan, Hackney Migrant Centre, and a JCWI lawyer. So the first theme I'm going to look at is around financial insecurity. And I've highlighted a couple of quotes that I think bring this to life really well. So I spoke to Evelyn, who said to me, "The pandemic has affected a lot. You can't go anywhere. I'm not working. I'm dependent on vouchers. So if my food is finished, it's finished." And Maria said, "I can't afford to be sick, and I can't afford to give the virus to others either." I think these quotes really highlight the additional challenges that undocumented people have faced during an already incredibly difficult time. Being denied access to the safety and support that most of us can rely on if we get sick. And Maria's quote highlights the very difficult choice that so many undocumented people have been faced with between protecting their own and public health or continuing to work in order to eat and pay rent. Everyone I spoke to during this research spoke to me about surviving or just trying to get by during the pandemic. To think a bit more about where this financial insecurity comes from, there's a condition, no recourse to public funds, that bars most migrants from accessing most public support, including universal credit, furlough and sick pay, lifelines to so many of us during COVID. And this condition applies to all undocumented people. Long before the pandemic, the no recourse to public funds restriction pushed migrants into poverty, unsustainable debts, homelessness, and unsafe and overcrowded housing. But since the COVID outbreak, which caused rising unemployment and widespread loss of income, this situation has worsened significantly, leaving many destitute or at risk of destitution. For undocumented people, the reality is that losing work means often losing all income overnight and racking up huge debts. The next kind of theme that came through in this research was around employment and the precarity of that. I spoke to one woman, Stella, who said to me, "Our everyday living is hard if you're undocumented. Today we have a roof and a bed to sleep on, but we always have the worry, where will we sleep tomorrow? How I wish they could know our situation. We are just humans. They think of undocumented people as illegal. They just don't know that being undocumented means, unfortunately, we have no legal papers, but we are still human. We still have the need to work, but we need to hide working." I think this does really well to kind of highlight the impossible situation that undocumented people are forced into by hostile environment policies. Just like the rest of us, they need to work to survive, and very often in the exact roles that kept our society going throughout the pandemic, kept our supply chains moving, caring for our loved ones when we couldn't, and yet they were criminalised for doing so. The illegal working offence and right to work checks are hostile environment policies which force undocumented migrants into precarious, unregulated and low paid work. As a result, they're often overrepresented in jobs on the front line of this crisis, increasing their exposure to COVID, yet simultaneously unable to access most employment protections and rights needed to keep them safe if they lose work, fall sick, or suffer exploitation, as they tend to do. Everyone I spoke to through this research had lost their job at the start of the pandemic, which goes to show the kinds of jobs that people were working in. 4 of those haven't managed to secure any employment since. 3 people have, but only very reduced hours, and only 1 person is back to his pre-pandemic work schedule. It shows how these effects are kind of still very much ongoing, even 2 years into the pandemic. The third area I wanted to talk a bit about today is around insecure housing. And Dolores told me, "Last February, all the members in my house, except for me and my baby, caught COVID. My partner got COVID. We have no place for isolation. We just put a pillow as a barrier between me and my baby from my partner. We have 1 room and other people live in the other rooms." I think this really goes to show that for many undocumented people, following government guidance and isolating when needed was simply not possible, which put themselves and those around them at greater risk. So policies, again, like the illegal working offence, no recourse to public funds, and discriminatory right to rent checks mean that undocumented migrants are more likely to live in unsafe and overcrowded housing. As a result, since the onset of COVID, they've been less able to effectively isolate to protect themselves and others. They've also been more likely to face homelessness, despite schemes like Everyone In and the temporary eviction ban, which further increase their risk of contracting COVID. 7 out of 10 of the people that I spoke to told me that they would not be able to safely isolate if they needed to. Several people we spoke to also experienced homelessness during the height of the pandemic. One woman sleeping on buses and in busy night shelters, where she told me that there was no possibility of distancing from people after she was refused by everyone in, as well as a homelessness charity. Others sofa surfed, and one person was evicted with 4 young children. The final area I wanted to kind of touch on today is around barriers to healthcare. And this is an area that we could have written a whole report on its own. It's so relevant to the pandemic, and it was such a huge issue that came through for people. Blessing, who you're going to hear from in more detail later, told me, I know many people die of COVID because they're scared of going to the hospital because they don't have papers. I was always scared when I was pregnant. I was scared that if I went to hospital, would they hold me down because I don't have papers? This is a really sobering report, but I think it's a really important one. Sobering quote, sorry, but a really important one. The fact that many undocumented people would choose to stay home and face potentially serious illness than access healthcare and risk the chance of being reported to immigration enforcement says so much about just how damaging the hostile environment in healthcare is. It's well evident that NHS charging and data sharing with the Home Office have created a climate of fear and distrust, which deters migrants from accessing healthcare, including those eligible for free NHS care. Undocumented migrants have reason to fear seeking medical care as they're not eligible for free NHS care, and their data may be passed on from NHS Trust to the Home Office. This could result in them being targeted by immigration enforcement. These policies are dangerous by non-pandemic standards, but during a crisis, they're irresponsible to the extreme, leaving many at heightened risk of COVID and less able or willing to access the vaccine. They also serve to undermine public health efforts and crisis recovery. So what are the implications? Number one, I think this research really showed that undocumented migrants' experiences of COVID need to be considered within the context of worse outcomes for Black and minority ethnic people. There's very clear evidence that shows that Black and minority ethnic people experience higher rates of serious illness, hospitalization, and death from COVID. That in order to tackle race disparities in COVID outcomes and improve public health for all, undocumented migrants must be recognised as a significant minority within the UK's Black and brown population. Secondly, it's very clear now that the hostile environment is putting migrants' lives at risk, but also undermining public health efforts. This has always been the case, but the pandemic has intensified the effects of these policies and subjected undocumented migrants to the worst outcomes from the virus. If the government is serious about protecting all our communities from COVID and returning to life as normal, it must put public health first before anti-immigrant policies and immediately suspend the hostile environment. Finally, charities have been forced to fill the role of the state. It was really clear through this research that through speaking to Francesca, who you're going to hear from, and Hackney Migrant Centre, but also hearing anecdotally that all over the UK, small frontline charities who are already overstretched have extended their remit considerably to meet the needs of undocumented people, many of whom would be left with nothing without this vital support. In some cases, frontline charities have shouldered significant public health and other responsibilities, stepping up to fill the gaps in state provision, for example, through vaccine pop-up clinics and things like this. So what are our recommendations? Number one, we're calling on the chair of the public COVID inquiry to include migrants, including those with who are undocumented, in her inquiry into what happened and what went wrong with COVID. It's really crucial that the experiences and voices of migrants are central to this inquiry. In particular, we want the inquiry to consider the impacts of hostile environment policies on migrant communities in the context of a pandemic. So JCWI has drafted an open letter, which we'll be sending round for signatures to send to the chair by the end of the week. So it would be brilliant to get people's support with that. Secondly, end the hostile environment from all areas of public life. This includes suspending no recourse to public funds. Everyone living in the UK, regardless of their immigration status, must have access to public funds to ensure that we can all weather this crisis. And implementing a firewall between the NHS and the Home Office and scrapping NHS charging has never been more important. And it's crucial to ensure healthcare and COVID recovery for all, regardless of status. Third, we want to introduce a new 5-year route to regularisation. The current system is so complex and restrictive that it pushes people out of status. A 5-year route would simplify the immigration system and provide a clear route back to safe status for people forced out of it. And finally, we're proposing abolishing the illegal working offence and introducing a work permit system. It's very clear that banning undocumented migrants from working legally does not reduce the need for people to work in order to survive. Illegal working offences simply subjects undocumented migrants to exploitative work and leave them unable to report labour violations for fear of being reported to immigration enforcement. Instead, the government should introduce permits that can be obtained with an offer of employment, and this could then be relied upon as part of the regularization process. And this is a system which happens in other comparable countries. Thank you. I'm just going to end this, stop sharing. Thanks very much.
Thank you very much for that, Caitlin. What we'll do, if that's okay, everyone, we'll come to questions at the end of the presentations. And if you can put your questions, if you have any, for any of the panelists, in the chat, and if you can put a Q, a big capital Q in front of it to kind of, so we can pick out that it's a question rather than a comment, and then we'll try and get to that at the end of the presentations. So our next speaker is called Blessing, and we're very, very pleased and privileged to have Blessing here. Blessing moved to the UK from Nigeria 13 years ago. She lives in London with her partner and with her 4 children, who were all born here in the United Kingdom. And she hopes one day to become a nurse and help more people through her work. So Blessing, thank you for joining us today. We're really pleased to have you here. Could you unclick your mic and please explain your experience that you've had throughout this pandemic and the lockdowns that have resulted?
Thank you for giving me this opportunity. My name is Blessing. I've been in this country for 13 years. I'm a mother of 4. Before the pandemic, I've been doing some domestic job, which I'm able to put the food on the table, take care of my kids as well. But when the pandemic started, things changed because of the COVID outside. And the government announced no movement. It really affects the little job I'm doing outside, whereby I go to people's house to clean their house, do some domestic job, whereby I can't able to do that anymore because of the COVID. And another thing, I'm not entitled to benefit because I'm an undocumented migrant, whereby I'm illegal to do some job because I don't have a document to do the job. And before the COVID started, I've been able to do the little I can do, whereby I pay my bills, I pay my house rent with the little I have. But when the COVID started, things turns around. I can't able to do what I'm doing before. Our bills keep on accommodating. We can't able to pay the bill to the extent the landlord cannot take it anymore. He have to take us to court, evict us from the house. And this affects my kids as well. I have to show the letter to my kids. This is what is going on. We are evicted from the house. And the kids were worried, they're crying. Mommy, where are we going to go? A lot of questions keep on rising. Later, this affects my kids at school as well. The kids in school doing well, they are not doing well in school anymore. They are worried, they are not happy, they are not focused on their education. The school have to call me, my kids are not happy in school. They told them we're gonna be evicted from the house. And I told the school, we're gonna be evicted from the house, we don't have where to go. To cut the story short, thank for the acne migrants who came to our rescue, who fought for us. If not for the acne migrants, maybe we could have been on the street, all because of the kids who fight for us for where we are today. We can have a roof on our heads. We are evicted from the house. About the finance as well, things are very tight. We find it difficult to even to buy 1 pound milk for the kids to use for their breakfast and for their tea. But before the COVID, things have been going well. We can manage the way we are doing. But the COVID affect everything. No money coming in, no money going outside. thank for Aquaba as well, who stood by us. That's another charity organization who help us in the area of finance as well. That make the family happy once again. Things are very tight. Let's go into another aspect as well, whereby this COVID opens a lot of people's eyes. There are a family of 5, family of 7 sleeping in one room because they are undocumented migrants, because they are not entitled to benefits. Things are very tight. You are sleeping in your house, you close one eye, you open one eye. You can't sleep and live comfortable in your house. You're going in the streets, you're scared, so that they won't deport you to your country. They won't deport you to where you're coming from. You were very scared. Things are very tight for undocumented migrants. Even now, people are dying at home. They are scared to go to the hospital, all because they don't have documents. They are immigrants. They are scared to walk into the hospital. They are scared to check their health, all because no documents. These are happening every day. I remember when I was pregnant, I'm scared to go to the hospital. They may use this opportunity to deport me back to my country, which at the end of the day, I lose my first baby. All because I'm scared. I'm afraid. I don't want to go back to where I come from. Even the vaccine now, people are still scared to take the vaccine because they may use that opportunity to deport people back to where they come from. Things are very tight for undocumented migrants in this country. It affects the kid as well. Even in the school, it affects the kid because their parents are undocumented. They are not access to have the school lunch, even the uniform. I remember when there was COVID, the last time when this footballer announced he doesn't want any kid in this country to go hungry. All because their parents, they don't have the access to benefits. They are not entitled to that advantages. These kids are born in this country. They are the future of this country. They are the MP of this country. They are the doctor of this country. They are the nurse of this country. All because their parents, they are on documents. It affects the kids. When they are giving other kids, which are entitled to benefits, school uniform voucher, we are not entitled to it. All because we are undocumented migrants. Why is it like that? We are human beings. Let's look at another aspect. Now, the NHS are short of staff. The school are short of staff. The care home are short of staff, whereby we have millions of migrants outside, ready to do this job, intelligent, have the brain, have the power, have the wisdom, all because they don't have documents. They're scared. They are denied of the access. If government can look into this undocumented migrants, it's going to help their life. It's going to help their country. They're going to contribute into the country. And let's look at another aspect. If the charity organization is not there, life with undocumented migrants is very tough. There are people in this country, 20 years, 15 years, 21 years, they haven't got their documents, which is very sad, which is very bad. At least you arrive in this country for 5 years, you can able to file in your papers and get some things. They would, because we are undocumented migrants, we are denied of a lot of access. Even the housing, you will see 7 children in one room with their family, all because they don't want to go to the government. They are not entitled to benefits. They are not free. Things are very tight for them. If government can look into this case, it's going to help undocumented migrants. 20 years in the country, you don't have papers. You're doing some domestic job whereby the energy you can use it to some job that you can contribute into the country. All because there is no papers. There is no document to do all this. Migrants are facing a lot of things. If government can look into migrants' situation, this country is going to be more better and the migrants going to be happy. There is a lot of job outside at the earlier, as I said, the earlier time. I remember another thing, when we are evicted from the house, I think this will be another opportunity. When I get my paper, I will try to move on and do a good job, whereby this free adult education, I apply, I pass the assessment, first assessment, for me to further run, because I don't have the documents. I was denied the access. I was so sad. I'm not happy, which my dream was one day I will become a nurse. In me, they have killed the intention in me. Look, another aspect, you arrived in this country at the age of 40, and you've been in this country at the age of in 20, and the 20 years with the 40 years, you're 60. They have killed the energy in you. They have killed the power in you that you want to give to the country. And that 20 years, you go for another 10 years routine. Then you will be 70. Do you still have the power? Do you still have the energy to do the job? Why not giving the people the papers when they are ready to do the job? Is it when they are getting old before they can get people paper? We are human beings as well. You can't buy things the way the other kids buy. The kid will come they will tell you, Mommy, my friends are going for holiday. When are we going for holiday? All because we don't have the document to move around. It affects the kids, it affects the parents as well. If government can look into a migrant's life, their life will be better. Let's look at the Home Office charges as well. They know we are undocumented migrants. We are the people that pay more. Family of 6, government expects them to pay 20,000 pounds, 20-something thousand pounds. Where did government expect them to get this money from? And they know they are undocumented migrants.
Blessing.
Yes. Yes.
I'm gonna ask you to wrap up now, if that's okay, my love, because I'm gonna need to get in the last speaker, but we're gonna come back to you for questions and answers. Is that okay?
Yes.
Do you want to kind of wrap up, or do you want to come back?
I want to wrap up. Thank you so much for giving me this opportunity.
Brilliant.
Thank you.
So you've wrapped up, or you're going to wrap up? All right.
Thank you for giving me this opportunity.
No, you're going to have more opportunity to speak because we want to hear more from what you've got to say. You've just articulated with more passion the case for undocumented migrants that I've heard in this place since I've been here for 6 years. So we'll hear more of you, I think.
Okay.
And we'll come back to you very shortly, okay?
Thank you. Yeah.
Thank you. So thank you very much for that, Blessing. A first-hand account of someone who's lived here 18 years as an undocumented migrant who is, as far as I think anyone on this call is concerned, a part of our community and yet isn't treated as such. To discuss this a bit further, I'm going to introduce now Francesca Humi. Francesca is the Advocacy and Campaigns Officer at Kanlungan Filipino Consortium, and she provides immigration casework and advocacy and supports the organization's campaigning on migrants' rights. She previously worked in inclusive education at the London School of Economics and in peace building in the Philippines with the NGO International Alert. Francesca, your 10 minutes begins now. Please take it away.
Thank you, and thank you so much, Blessing, for sharing your experiences. That was so moving and just really powerful. And a lot of what I'm going to share will echo what you've shared with us today, which really shows how widespread these issues are and how systemic they are. So at Kanlungan, we're mainly a Filipino migrant charity, but most of our service users are Filipino migrants with no recourse to public funds. But we do have a growing number of service users from East and Southeast Asian migrant communities. So the majority of our service users work in the healthcare, social care, or domestic work sectors. And really, the pandemic has had a near devastating impact on the Filipino community. We've had really high COVID infection and death rates amongst Filipino NHS and care worker staff, especially in 2020. People who weren't destitute became destitute as they lost their jobs without being eligible for COVID-related government support schemes, as Caitlin mentioned. And still whilst still not having recourse to public funds. We witnessed a lot of people really struggling to self-isolate or to cope with COVID in the context of overcrowded housing, whole families sharing one room, or multiple families or individuals sharing one room at a time at which COVID was circulating really highly in the community before the vaccines. We also saw a really high number of domestic abuse cases being reported to Kanlungan, and us really having to meet those needs and to expand our services. One particular group also really struggled with the impact of COVID, and those were domestic workers. A high number of Filipino migrants in the UK are domestic workers, and many of them are live-in workers, either doing care work or cleaning work or childcare. And so what happened with them is that if they lost their job, it also meant that they lost their accommodation and were effectively made homeless without being able to access any kind of housing support from the council, and then having to rely on community level hosting, which again, during a pandemic was extremely dangerous and risky for people to let in other people into their households. And even though there was a government ban on evictions, this did not stop employers. Sometimes one service user that I supported during the pandemic reported to Kanlungan that her employer had gotten COVID, and then she subsequently got COVID. And once she tested positive for COVID, her employer made her leave the house, and then she was both positive with COVID and homeless. And again, despite any kind of eviction bans. And what we saw is that because these people are undocumented and don't have recourse to the usual complaints mechanisms, there's very little that really can be done, in effect, to stop them from being evicted in this kind of situation where they are living with their employers. There are a lot of people who simply couldn't afford to self-isolate because they weren't working in formal jobs that gave them sick pay. There were situations where, for example, multiple care workers or domestic workers were living all together, and one person tested positive for COVID and the other members of the household were still continuing to work because they simply couldn't afford to not work for 2 weeks. So Kanlungan's work during the pandemic really, like I said, met community needs where they were, and it really felt like just a non-stop emergencies that we needed to respond to. And it really felt like Kanlungan was the only place that service users and that community members had to turn to and ask for support. So we expanded our work in a really major way. For example, we delivered food to people across the country who were ill and were self-isolating. So, for example, we would say, you know, if you self-isolate, then we will deliver food so that you don't have to go out and so that you don't have to go to work. Because again, that was a major issue, is that people needed to work, people needed to pay their bills, to send remittances back home. And so just having those groceries delivered to them for 2 weeks was a huge help and actually enabled them to self-isolate for as long as they were positive. We provided advice on immigration, housing, welfare, healthcare access, domestic abuse, on how to access food banks, on all of these matters. We also started providing one-to-one counselling in Filipino community languages and peer support groups for Filipino community members. So, for example, we set up a support group for single young Filipino mums who were really struggling during the pandemic to raise their children in isolation and also oftentimes in destitution. And based on that, we really wanted to build our community groups and expanding our network, so encouraging people to form local community groups with each other, sharing information with each other about resources, making sure that migrants who were previously isolated, because I think it's really important to note that if you're an undocumented migrant, the number of meaningful long-term or intimate social connections or relationships that you might form are quite limited, because there is such a high fear that you might be reported to immigration enforcement that people tend to avoid having those kinds of relationships, and therefore often end up being really socially isolated. So we thought that it was really important to actually encourage social connection and community to build that solidarity amongst Filipino migrants and across migrant groups. A huge chunk of our work was to provide Filipino community language information about the pandemic and relevant public health guidance. We also provided a lot of information about the vaccine, because initially there were some issues about vaccine hesitancy, and we really wanted to make sure that people could get the vaccine as soon as they could. We also hosted pop-up clinics in association with NHS North East London and Hackney Giving. And so these were pop-up clinics that were specifically designed to deliver jabs to people who were undocumented, who didn't have proof of immigration status, who didn't have any kind of proof of address, who maybe were homeless or didn't have any permanent address. And these community level pop-up clinics were really important because it enabled us to deliver the vaccines to the people who wouldn't necessarily have been able to get vaccinated otherwise, because they weren't registered with GPs or because they were too scared to give their information, but also gave us a chance to do community outreach and asking people about what kind of support they needed, giving them advice, signposting them to other services. And really, during that time when we were planning these pop-up clinics, I spent a lot of time on the phone with people who were anxiously calling me, who were undocumented, telling me that they really wanted to get vaccinated and they wanted to come down sometimes as far as Scotland to get their vaccine with Kanlungan through the pop-up clinic, because they were so scared of immigration enforcement in their local GP surgeries. And in some cases, I even had to speak to, like, if they were care workers or domestic workers, speak to their employers on the phone to explain the situation and to explain why they needed to get the jab in these pop-up clinics. And similarly, I supported a lot of service users who maybe had spent 10, 15 years without seeing a doctor once in the UK because they were undocumented, and really holding their hand through the process of getting them registered with a GP and getting them their vaccine doses to make sure that they were safe. We also did a lot of campaigning around calls for regularization. We joined the Status Now network, which is demanding for all migrants to be regularized immediately. And we also expanded we worked a lot in collaboration with our colleagues at JCWI who are here, and colleagues at Doctors of the World, Project 17, to really support our service users in all of the different needs, because now it wasn't just like they needed support on their immigration issues, they needed support on healthcare, on housing, on welfare, on all of these things. So we really saw cases that were complex and quite intensive in the support that was required. And another observation that is featured in the report and that I'll talk about here is that what we've seen is a need, and that Blessing also highlighted, is that we've seen that charities have really been forced to fill in into state responsibilities. So in effect, you know, what we see with the NRPF condition and other measures under the hostile environment policy, for example, data sharing with the Home Office or immigration checks done by, you know, overzealous GPs in their surgeries, essentially amounts to the government shirking its responsibilities and washing its hands of migrants and their problems. And it's actually quite comparable to the neglect that we see from the defunding of local community services through austerity under this government. Again and again, services that should be delivered by the government are subcontracted or just left to be filled in by community charities. And obviously it's good that organizations like Kanlungan get funding to disseminate information relevant to COVID, and you know that we're disseminating life-saving information to a community that trusts us, and it's important that they trust us. But it kind of makes you think, how and why have we gotten to the point where a local community charity becomes the lifeline for vulnerable people in one of the richest economies in the world? And that's what happens when immigration enforcement becomes the priority that trumps everything else. And we've seen that recently with media coverage of immigration raids taking place at care homes, where care workers, frontline workers, people that this Prime Minister has been clapping for on his doorstep throughout the pandemic, those people are now being punished for providing the essential care to our elderly people, to disabled people, and are being deported from the country. And this is only happening because the care sector is, you know, so undervalued, and there aren't enough wages, and you know, and the working conditions are so poor, and people are stepping in to fill in a gap in the labor market, and then they're being punished for it. So, and again, like Blessing has said, and like the report says, we have a situation where people would literally prefer to risk dying at home alone without seeking medical treatment, rather than going to hospital and potentially facing immigration enforcement. And that is just absolutely shocking. And we know of multiple people in our community who died in this way, because that is how terrifying immigration enforcement is. That is how terrifying and punitive the hostile environment policy is. It's like this by design. And I really hope that reports like this one will help shine a light on all of the issues in the hostile environment policy, and that we'll be able to move forward to remove these really terrible policies. Thank you.
Thank you, Francesca. Thank you for that. Very much appreciated. I think before we go on to questions, I just wanted to kind of fire off a few of the comments that have come up. But I think the first thing to say is that, Blessing, there was a lot of love for you. There is a lot of love for you being shown on the chat. I hope you can see that for your bravery and the comments that you made. So thank you for that. Couple of comments. There's been lots of really good comments on here. One of which that jumped out at me: there's a legacy of inhumane treatments towards undocumented people and migrant people. It's not just about party politics. There is some truth in that. And also hear someone explaining, my husband wanted to do some volunteer work with the NHS during the pandemic, but his request was refused because he was undocumented. He has a master's degree in medical biosciences from the University of Bath. He was in the UK as an asylum seeker for 12 years. Hopefully he could get a scholarship and did his undergraduate and master's here. even though there was a shortage of staff in the healthcare system, he was deprived from volunteering. One of the questions that jumped out at me, which I'd like to ask everyone, and perhaps Blessing, you can start with this, is a question on amnesty. And I'm just trying to find it now, so I can find it. Yes, this is from Bernie Howley, and it says, Blessing's fear and frustration is palpable, and she's not alone. Is anyone thinking of offering an amnesty, clearing the system? The Home Office is totally bogged down. Until this is sorted, Blessing and so many others are stuck, and the country is losing out on such a rich pool of skills, etc. So really the question is, how far would an amnesty go in solving some of these problems? And Blessing first, and then we'll go to Caitlin and then Francesca.
Thank you for giving me another opportunity. This amnesty is going to go a long way. People will be very happy. I will be very happy if government can do this, because we are facing a lot. We don't have freedom. Even you want to do some charity work, they will be asking you, what is your documents? Amnesty will go a lot way for people. We have our freedom. We have the right to work and contribute to the country, which is going to help the country as well. It's going to help us as well. That is all I can say for now.
Thank you, Blessing. Caitlin.
Thanks very much. Yeah, I mean, one of the things that we are campaigning for at JCWI, because whilst I can see the benefits in an amnesty that they would provide people with status, we believe that it wouldn't be targeting the root problems of our immigration system. If you were to grant a one-off amnesty, those problems would remain, and in 5 years from now, there would be a huge population of undocumented people yet again, and that's only going to get worse with the new Nationality and Borders Bill coming through. So instead, we're proposing tangible changes to the immigration system that will improve it for undocumented people now and in the future. The main one being, which I mentioned at the end, but a 5-year route to regularization, because as Blessing mentioned, at the moment, undocumented people can be in the UK for over 20 years and they still don't have access to status and to safety and to the right to work, the right to rent, the right to access free healthcare. And so we're proposing a 5-year route that would allow people who have lived in the UK and oftentimes been forced out of status by the harsh immigration system to regain that status again after just 5 years, instead of the really, really lengthy, complex and extortionate processes that are currently in place. So yeah, that's kind of what I would say to that. Thanks.
Francesca?
Yeah, I'd echo what Caitlin said and what Blessing said and what's being said in the chat. I think amnesty, although I don't really like using that term because it implies that you're getting amnesty for a crime that you committed, when immigration is, there's nothing illegal about it. So we prefer the term of either immediate leave to remain or status now or regularization. That I think it would be a brilliant short-term immediate solution to a lot of the issues that we've pointed out now, because then people would no longer have no recourse to public funds. They'd be able to to access healthcare and all of these other social support systems. But then the more long-term solution has to be meaningful reform to the current immigration system.
Brilliant. There's a really good question. I think it's a good question, and I wonder if anyone has a take on it. And it's from Callum Dawkins, and it says, I work for a refugee charity in Bristol. How do you see small localized charities best campaigning to make the state take the lead on supporting people rather than leaving these charities to be the lifeline? If anyone wanted to kind of come in on that, it's quite an existential one, that one. It's a biggie.
Francesca, I'll let you go first because I feel like you've got more experience with this.
After you.
Thanks. Yeah, that is a really good question. And it's hard because at the same time, local level charities that are really involved in the community and know the community better are best placed to deliver that work, but aren't best necessarily resourced to do that work. So I think the first step would be is obviously to get better funding and better long-term sustainable resources for local charities. And there are ways around which I realize this is maybe not necessarily the question, but there are ways around which you can force local services to take on cases. You know, maybe you argue if there's children, you might argue that under Section 17 that they have a duty to, you know, safeguard the child or to support the child. There are ways around which you can kind of force the council or social services to take on responsibility in a sense. I think there are cases where people don't necessarily know what the actual requirements or regulations are, and so it can be a matter of just like pushing and prodding and reminding people who are at the council level or in social services or in domestic abuse support services of what their duties are. But it takes a lot of time, a lot of patience, a lot of energy, a lot of resources to do that constant pushing and shoving and working together as a team to support individual cases. But yeah, I think there's also something that is difficult, and I don't necessarily have a solution, is that when you are such a small level charity or you're more grassroots and you're dealing with immediate, maybe urgent casework, it can be really difficult to make the time to then feedback all of what you're seeing on the ground and all of the issues back into a higher level, whether that's high level local government or national government. And I think that's the value in joining networks like migrants' rights networks, like the Status Now network, like there's a network with Migrants Organise, and joining other groups that have more national reach and working through them to feed back what you're seeing on the ground and building solidarity with them.
Brilliant. Do you want to come in on that, Caitlin?
Yeah, I would just add to that. I mean, kind of comes off what Francesca was saying there around a lot of the time, these small frontline organisations are the ones that are seeing these issues face on and have the most experience of what is really going on for migrants on the ground. But as she mentioned, they might not always have that capacity to do that campaigning or the resource there. And JCWI, we do kind of national campaigning and policy work. And I think it's so crucial that organisations like ours are remaining in touch with the small grassroots organisations on the ground around what's going on, and then using that to feed into our policy and campaigning work. And I hope that through work like this report, where we spoke to grassroots organisations, and then that can feed into the work that we're doing in Parliament, we can see more examples of this kind of collaborative work going on across the sector. I think it would be a really, really positive thing, and that we can kind of share those skills there and share that capacity to work together to make sure that we're reflecting the issues facing migrants at a kind of top level, at a parliamentary level, in our more national campaigning.
Yeah, thank you for that. Someone's asked a question, I think Zoe's asked a question about any intelligence on the terms of reference for the public inquiry. I don't have that present, but what I will promise to do is to, if I can find out anything, I'll make sure I pass that on to JCWI, ensure that they have anything kept up to date. And it's something I will look into because I can see how important this is going to be. I think we've got time for kind of one more question, and it's a kind of data-driven question. And a kind of data is king at the moment. And it really is just to kind of ask, is that lack of data part of the problem that we're facing at the moment in this area? And is there anything, I mean, would more data be helpful?
Yeah, yeah, definitely. I mean, as I kind of said, and as we say in this report, there is clear evidence of the disproportionately negative impact of the COVID pandemic on Black and minority ethnic communities, but there is a complete lack of similar research regarding immigration status and the effects on migrant communities in the UK. And that's partly because immigration status isn't monitored and isn't collected. But I think it's really important that we start to see this as another factor within this broader context of disparities in outcomes from COVID. And I'm hoping, or we're hoping, that with this research will kind of prompt further research. I know that Kanlungan have already had a really brilliant report out just at the end of last year, looking specifically at Filipino migrants, and that this is something that within the migrant sector we're very concerned about, but there needs to be more data and more research on this. And that's exactly why we are calling on the chair of the COVID inquiry to just make sure that she includes migrants and those who are undocumented in her inquiry, so that we can get that really robust kind of national level data to add to this picture as well.
I have some more questions. We do have a bit more time, I've been told. I just want to read out one comment here from, or maybe I don't have time. Well, the bell's gone for me. I'm not sure. Hold on 1 second. See if I have to go and vote. The Morlock bell has just gone. Oh, I think that's actually good news. I don't think I have to go and vote. Good. Right. So I wanted to read out a comment from Hilda Canap, which is, the less people rely on government, the better. Take back your power by uniting with others. Public inquiries go nowhere. I think that's a very valid and legitimate observation. I think we can do both. And I think ensuring that the terms of reference in here at least cover some of the areas of interest and concern that this publication has raised is kind of hedging our bets. But I think that's a very valid comment, that actually we shouldn't hold out too much hope for what this public inquiry will cover and what it will actually end up doing. I've lost count of the number of public inquiries, and yet it's something that we have to, a base that we have to cover. One question for Blessing, if you're ready, if you're okay with this, Blessing. The question is, it's about access to healthcare. And it says perhaps one of the most dangerous aspects of the hostile environment in this crisis is how it impacts on people's access to healthcare. And the questioner wants to know, has that been a problem for you or for other undocumented people you know during the pandemic?
Thank you for the question. One, you don't have documents. You're scared to go to GP to register. And you may get to the GP, they ask you, where is your document? You don't have the document, they will tell you, we are sorry, we can't able to register you. You feel so bad. And you're sick. You can't go to the health center. They will still ask you about, can you identify yourself? It's very tough. And you're scared as well. If they know that you don't have documents, you are immigrants, they either call the police and the police, what is it called? The immigration. And I know some people have been deported through that process back to their country. That is why people are scared to go outside. Or they give you bills. If you even see some people, they will, okay, let's give you some bills, you pay. But some will use that influence to deport you to your country. I've seen some of the cases whereby because of this, they have to go back to their country. It's so sad. Health is very important in the body. If you don't check, assuming I have headache, this headache, I don't cure it in time, it may lead to something else. Before I know, I may be paralyzed. Is that when they will attend to me? After my body is damaged, is that when they want to see me? It's so sad. It's so sad. Thank you.
Thank you, Blessing. Thank you for that. There's a question that's come up, and it's one that I have to ask, which I think is kind of prescient at the moment. The question is, someone has put, how do you think voter ID will complicate this situation? And I would add in there vaccine passports, which obviously have the potential to be expanded. Both do. We don't have a national ID card system in this country, but both voter ID and vaccine passports feel like a step in that direction. And that, for the undocumented, that can't be anything but a problem from where I see it. Do you have any kind of views on those two issues? Francesca, would you like to go first and then Caitlin?
Yeah, thanks.
And maybe Blessing as well.
Yes, certainly for the COVID vaccine passports, it's already started to be a problem. And this is something that I've spoken about with people at Doctors of the World, and I know that they're on this call. But because we have, for example, we have people who work in the care sector who are undocumented or are not registered with GPs and therefore cannot generate an NHS COVID pass. And so for now, there's been no solution, as far as I'm aware of how you can get around generating a COVID passport, or at least like a sufficient proof of vaccination, if you don't have that NHS registration, which means that then people who aren't registered with GPs, whether because they're homeless or because they are undocumented migrants or because they, of other reasons, are going to be excluded from work, from other services. And it's a difficult conversation to have, because obviously we want to push for people to get vaccinated and for people to get their vaccines, and especially in the context of care homes, for care homes to be safe. But that can't be at the cost of excluding whole segments of the population who cannot register with GPs because of immigration enforcement or other issues. So I think there needs to be more work done to really do outreach to people, to get them registered with GPs, and to do it in a way that is completely free of immigration enforcement or any kind of immigration checks. And it's really shocking because a lot of for now, the people who've been affected are the people who are providing that primary healthcare, but they find themselves locked out of primary healthcare themselves. In terms of voter ID, I mean, if you can't, I mean, from my understanding, you wouldn't be able to vote anyway if you were an undocumented migrant. But I do think that it's going to put a lot of people at risk of not being able to vote if voter ID is required. If that was,
I think with voter ID, because it would then perhaps become universal,
right? Yeah,
potentially over time, it would then de facto become an ID card, because without it, so there are certain forms of ID that you can use to vote under the legislation, some that you can't. Voter ID cards would then the voter ID cards would then be for those that don't have that specific documentation. But there's nothing to stop this perhaps being changed by secondary legislation to say that at some point you can't vote without that. I think that's part of the slippery slope. So that's partly, but yeah. Did you have anything to add to that, Caitlin? Are you?
Not much, no. I would echo everything that Francesca said there. We definitely oppose vaccine passports for the very reason that they will create a two-tier society, and they'll discriminate against the most marginalized, not only undocumented migrants, but other people who are afraid of authorities or will be more likely to be racially profiled or targeted. So this is something that we strongly oppose, while simultaneously hoping that people will come forward and get vaccinated. But I think that isn't achieved through kind of scare tactics and this black and white system. That will be achieved only through kind of cultural specificity and education to the kind of people that we're trying to reach, through kind of the work of organizations like Francesca's, who are doing that with Filipino communities and others. So yeah, vaccine passports are definitely not the answer.
Good. Makes me feel better about breaking the whip on vaccine passports now. So question for you, Caitlin. This report is, of course, an in-depth look at some of the experiences and realities of life as an undocumented person during this crisis, obviously drawing from quite a small sample. How much evidence is there to say that the issues you've identified are a wider problem?
Yeah, I mean, there is a lot of evidence that hostile environment policies discriminate and make life harder for migrants, particularly undocumented migrants. In pre-pandemic times, there's a lot of evidence showing that hostile environment policies within the NHS deter migrants from seeking healthcare. That's including those with the right to healthcare. JCWI did a lot of research around right to rent that found that it makes it harder for migrants and British people of colour to rent a home. And all of all of these policies are well evidenced for the harm that they cause. And then you throw a pandemic into the mix, which worsens the effects of all of these policies, and vice versa, the hostile environment worsens the effects of COVID. There is a real lack, I agree, of kind of research around specifically looking at undocumented migrants in the pandemic. And that's what we're hoping to kind of begin that conversation and bring undocumented migrants into the wider conversation around effects on marginalized communities from COVID. And although this report was based on a small group of undocumented people, the issues that we were raising were things that we know anecdotally undocumented migrants have been seeing up and down the country, from speaking to other organizations, from speaking to migrants themselves, from work with our own clients at JCWI, but definitely a need for kind of further research in this area.
Thank you. One last question for you, Francesca, and then I think we'll kind of wrap up, unless I see any other kind of really key questions jump out in the chat. And it's about policy changes and solutions. And you spoke about the state stepping back and leaving people in these desperate situations. What could the government have done, and what needs to change to support undocumented people?
Yeah, it's a good question. Yeah, so they could have immediately, similar to what was being proposed with the amnesty, they could have immediately granted leave to remain to all undocumented migrants and all those in the legal process. They could have instituted a firewall between the NHS and the Home Office and done the necessary outreach to get people registered with a GP locally, and really removing any barriers to people registering with GPs and making that process as easy as possible. They could have scrapped the no recourse to public funds condition that's attached to most migrants in the UK. And they could have also scrapped the international health surcharge and scrapped additional charging for NHS services. A lot of some of our service users from that single mums group that I mentioned have ended up with astronomical maternity care bills during a pandemic because of the charging system that we have in the NHS. So again, it's the most vulnerable and the most destitute who are then ending up to pay NHS debt for years and years, which will then be used against them if they make an application to regularize their stay or make an application for them or their family. They could have also, and if they weren't, it's hard to say because obviously this current government would not offer amnesty to undocumented migrants at this rate, but they could have put in place at least cheaper or faster options towards regularization, because currently the way that people have to make applications to regularize their stay, not only are applications incredibly complicated and very limited in the eligibility, but also they cost a lot of money and require professional legal advice in order to navigate. So people, again, because of cuts to legal aid, are ending up completely indebted, paying sky high legal fees and Home Office application fees. And again, it's the people who are the most destitute who have to pay all of these charges. So yes, those are just some of the things that the government could have done. I really do think it is incredible to think that there wasn't just some kind of blanket firewall between the NHS or the Home Office during a pandemic, or some kind of mass outreach to ensure that every single person is registered with a GP. Just from a public health perspective, it doesn't make any sense.
Yeah. Thank you, Francesca. I think, and on that note, I think that probably explains why it's so important to ensure that the terms of reference for the public inquiry do look at these issues, do look at the impact it's had, and it's the fact that this would have helped us deal with the pandemic and kept the number of deaths down if we'd had a pragmatic and humane approach to this issue. Someone's asked me if the issue of undocumented migrants will be something that gets brought up in Parliament. This isn't an issue that's going to go away. The Nationalities and Borders Bill is currently in the House of Lords. It's unclear whether it will come back to the Commons. that now depends, and that's obviously an area where this is where the kind of debate would take place potentially on issues like this. It's unclear whether that will come back to Parliament only if there are amendments that are added or rejected or taken away from the bill as it went from Parliament into the Lords. If that happens, if that does, then it comes back to Parliament in what's called ping pong. But at present, my understanding is it's unlikely that the Lords will make any changes to that, and it will then be given royal assent and become legislation. But I think given the track record of this government, I don't think this will be the last time that the issue of migration and our approach to it comes up here in the chamber. So I think it will be something, a live issue until now and at least the next general election, particularly with this government and particularly with Operation Red Meat, which you may have heard of, which is, whilst Boris Johnson is Prime Minister, the attempt to try and distract the British public with as many hard right radical policy suggestions as possible. I imagine that migration and immigration will be issues that they would attempt to use to do that. Can I thank all of the speakers for today's contribution? It's been a very, very informative discussion. Thank you for everyone that's attended, especially Blessing, who's shown such bravery in stepping forward and speaking up. It takes a great deal of courage to do that. So thank you, Blessing. And I wish you all the best with your endeavours to become documented, yourself and many, many others. There are lots of us here in Parliament and beyond out there campaigning to make sure that we have a far more humane approach to migration in this country. It's an uphill struggle, but one many of us are committed to. Thank you, JCWI, for hosting this, for writing this report. I hope it's widely shared. It will be extremely useful for us in here. And thank you everyone for attending. It was a fantastic turnout. Thank you very much and good night.
Thank you so much. Yeah.
Thank you very much, everyone.
Thank you, everyone.
Thank you.
Thank you.
Bye-bye.
Good night.